Welcome, guys. Welcome to Gossip Jamaica. Here you're going to get some juicy contents. Stay tuned. Guys, this is something serious and we must not take it for a joke. Now, hear what this MP say. She accuses Alfred Dawes of hypocrisy and misleading comments about healthcare system. Now, Dawes is the Member of Parliament for St. Ann Northwest. Crystal Lee is criticizing People's National Party spokesman Alfred Dawes for what she says is his hypocritical failure to acknowledge major steps being taken by the government in its effort to reform the healthcare system. If you can't cry, then you just have to laugh. Because this is bulls. In a statement Thursday, Lee also chided Dawes for recent remarks not acknowledging what she says is the neglect the system suffered under the former PNP administration. But then the system still suffer. These politicians are the biggest liars. There's a saying, big lie and little lie. When a person lies to himself, that is a big lie. Because once they lie, they start believe it. Some people lie so much that them start to believe them own lie. Lee not truthful and Dawes not truthful. None of them not truthful. PNP, JLP. Hospitals start mash up under both government. Blaming one party is not going to fix the major problems with the healthcare. And God knows there are many flaws. Now, the health system, people complaining about it for a long time. And you know what? It was totally ignored. Totally ignored until the US government put on them immigration site warning people about the health system of Jamaica. This is when you hear people start talk about it. Before people say anything, it was just like a whisper. According to Lee's statement, Dr. Dawes held a media conference on Wednesday and pretended as if he was unaware of major reforms taking place in the sector, including the fact that 1,000 additional doctors will be given permanent posts. 1,500 new places for nurses in permanent positions have been finalized. Now, on top of that, these doctors need to have bedside manners, to be trained how to deal with people when them come in at the hospital with them sick patients, them sick family members, and how some of them are treated. But because, again, the doctor and the nurses, they are short staffed. You can't have one doctor and one nurse pan emergency ward all night and people keep coming in. Sick people coming in. Accident patients coming in. How them expect that to work? According to her, operating theater have been upgraded. Guys, when are these politicians going to stop trying to fool us? It is so easy to see the system is in a crisis. Even a blind man can see that it is in a crisis. And even a deaf person can hear it is in crisis. And that's how bad it is. Dawes on Wednesday called for an overhaul of what he claims is a broken public health system on the verge of crisis. You see why I say politicians lie to themselves? Because Dawes is saying it's on the verge of crisis. It is not on any verge of crisis. People, now you tell me, is the hospitals in crisis? No, it's not on the verge of crisis. It is in a crisis. And this is never ending. Problems are always with the system, day in and day out. In less than 2 weeks, the health system was exposed to the world on social media. And this is what the Minister of Health do not want to get out there. One woman spoke about her mother died because there was no ambulance or CT scan machine to save her mother. There was only one nurse and the emergency room and one doctor. And when they do get an ambulance, 4 people in there, and the saga go on and on and on. They couldn't do the transfer to this hospital. If she get private ambulance, they don't have no nurse to go with her because they're not insured and all sort of mumbo jumbo. And the woman will lose her mother, blast it out there on social media and tell people, say, show Tufton, show the Prime Minister, show everybody. And this is when you start hear them talk about the health system now. The JLP blame the PNP. Yes, the system did have go down long time. It was going down long time, but it continues sliding down. What have they done to even bring it up back to a certain level? The Minister of Health has revised the number of ventilators in the public health care system, and the ventilator was one of the problem why this woman last week lose her newborn because there was no ventilator in the big hospital, major hospital, and them keep calling around, and they couldn't. Some hospital was full to capacity when it come to that. Some of them don't have none, and guess what? For 4 days, people had to be manually trying to save that kid life. But that kid life could not have been saved because of ventilator. Now you hear him talking about ventilator. Last week, earlier this week, him come out and him give how much ventilator and how much. And now, he don't even know. That's a shame. He don't even know what is going on in his hospitals. Now he have to come out and revise it. That the number of ventilators in the public health system. During a media briefing on Thursday, the Health and Wellness Minister, Dr. Christopher Tufton, said in an audit found that there are 118 ventilators in operation in the public health system out of 210. But in subsequent media release, the minister said, based on reports obtained as of 6:43 p.m. Thursday from the Regional Health Authorities and University Hospital of the West Indies, the healthcare system has a total of 191 ventilators. The minister said, and the 191 ventilator in the asset registries, 120 are in use and fully functional. Now, you see that 120 in use? Make one of them get sick and want a ventilator and see how quick them find one. They probably would have even take one off a smaddy and care go put on them. And this is why you see they don't really understand what is going on and what poor people have to go through day in and day out, especially in the public hospitals. Just maybe less than a month, Tufton broke in hand. Hospitals, people complaining said there are no beds. And a little hand broke. And people in there dead. Major illnesses. And as he go in and get hospital bed. And I take video and picture from hospital bed. He should be ashamed of himself. Now, Tufton added that 71 ventilators are non-functional due to maintenance issues, including the need to spare parts that are not available in the country. Dr. Tufton noted that some machines will be decommissioned as they are either inoperable, irreparable, or irreparable, excuse me language, yes sir, non-compatible, or have come to the end of their useful life. So, what is his plans? Let me see if he had on plan here, so. He said the full list of equipment will be published on the ministry's website. If you must ask me, 120 ventilator in the island is just not enough to save people. It is sad that when children who could have been saved die because of non-existence of proper medical system. Now, come back to Dawes. Dawes said that Jamaicans are getting sicker and sicker. With diabetes, they're hypertensive, more people with chronic diseases, and aging population, and all of these increase the burden on the public health facility. If we are seeing significant improvement to keep up with the rate of increase in these chronic diseases and the aging population, then he says that we are going to reach a crisis level. What kind of crisis level is talking we are going to reach? It is at the level already. Take out the going out of it. And unfortunately, if we continue along the route that we, which is Jamaicans, taking, that crisis level will be fairly soon. It died already. What happened? The government have to figure out a way to keep up with the additional health issues. Cut some of them salary, 200, 300, blah, 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 increases that they get. Donate some of them. If all of them donate just one time, donate their salary, they can, because they have enough salary to live off. They can buy, if it's even one machine, if it's even to save one life. However, according to the government MP, it must be noted that under the JLP administration, the National Health Fund facilitates 3 million prescriptions per year, up from 1 million 4 years ago. She also highlighted that more categories of illnesses are being covered by the fund. And good for them. And this is what should be done. Ha 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 ha. Pat on the shoulder. Pat on the shoulder. Lee says it's unfortunate that Dr. Dawes failed to note major expansion work at several health facilities across the country, including the Spanish Town Hospital, the Noel Holmes Hospital, and the new state-of-the-art facility being built in Western Jamaica to attend to the healthcare need of Jamaicans. She further noted that the Christopher Tufton-led health ministry has been open and transparent about issues facing the sector. Denial, denial, denial. Issues facing the sector. Denial, denial, denial. They're not open. It's happening, but they're not open. You think some will go out there go talk about people who die because they never had this and they never have that. Sometimes they don't even get to his ear. So, what she's talking about, open and transparent, that is bull. She expressed that while there is much work to be done, it must be noted that the JLP administration has made progress in addressing several issues, including shortages, especially as it relates to equipment, gears, and human sources. That is true, because now them addressing it. They even investigate what a woman where her mother dead. And I have a video here about the woman who lose her mother. You can go back and look at it. That was very, very horrible. The woman went through so much that she had to blast it and ask people to spread it on the news. Spread it on social media so that Tufton can see and do something about it. And because of that, sometimes it takes just one person, just one brave person to do something. Because of that, all these things about healthcare coming up now. Because Tufton, no one them something here. What happened a yard not supposed to spread abroad, it's supposed to stay a yard. The Centre Northwest Parliament, Member of Parliament, has also described as less than forthright Dawes' criticism of the programme. And Dawes don't have no reason to criticize the programme neither, because they have had their chances and then blow it just as much. And as me say, whether it's the PNP or the JLP, the system had been ignored for years. And it is still being ignored until up recently. And it's sickness. We cannot sit back, fold with arms, and watch and wait to see what they're going to do. It needs to be done right away. No CT scan machine. How can you not have MRI machines, CT scan machines in a hospital? That if somebody come in the night dying, somebody can run them there, have pictures taken so that the doctors know how to handle the patient. How can a doctor don't have any equipment to see what is going on in a person's body tend to an accident patient that come in? Even the brege boy them, like the gunman them we get shot in there, or even then shot innocent people. What can they use? Just their eyes and their common sense. Something needs to be done. Something has to be done about this. And on the other hand, talk about ambulances. The hospital them need to be equipped with ambulances too. Things happen to people, they have to throw people in their car, bring them a hospital. Some of them dead, and it's just a mess. Tufton, it's just a mess. And what this woman has said, stop doing the blame game. PNP, JLP, this is what you talk. These are people's lives you're talking about. Stop bickering and fighting for political reasons, and stop doing the blame game, and come together as a unit and try to fix the healthcare system. We're not talking about hog and goat here. And if a hog and goat, people are build good pen for them nowadays. If you have watched the video this far, kindly make sure you like, you share, you comment, and you hit that notification bell so you'll be notified on new videos.